Okay, it has started. And also, before we begin, we always like to honor those who are with us and let them know why we have asked them to come and honor us with their time. One thing, Kelly was just really excited about all the things that you're doing with the Clinical Sleep Health Navigator
Mhm.
exam.
Yeah.
And she was like, oh my God, there's something out there already. It's coming, it's coming. So we wanted to have you talk about that. And also, as inpatient navigators, we are seeing, sorry, that's my little dog that wants to make noise. Sorry, excuse me. Um, we are seeing patients in the hospital and we have to refer them to behavioral sleep because we only have a few little minutes and there's not much we can do in that time, but we can recognize, okay, what you're dealing with, let's refer you to a behavioral sleep specialist. So I think sometimes in sleep, I was telling Kelly earlier, we kind of forget that there is some assistance with that. And we'll, a lot of times, as you know, we've been in the field for a very long time. We're seasoned. You hear the something up. You can handle it. Just keep trying, keep trying. It's like, won't you just refer them to somebody? You're not handling this correct. Let's do something a little different. So we want you to talk about that. So we're so excited and honored that you're here. Now it's Kelly's turn to tell you.
Yeah,
Yes.
thank you.
So thanks so much for coming on, Dr. David. Just for our audience, I had the opportunity to meet Dr. David and speak with her and a few others at their meeting. It was 2 years ago, I think, which time goes by so fast at the Society of Behavioral Sleep Medicine regarding the exam. And I've been waiting patiently for this to come out. And I just feel like, granted, I'm not a social media person. So maybe it's on other social media formats. I'm really just on LinkedIn, but I haven't heard a lot about it. And people that know me at Wellstar that asked when I went to speak, they keep asking me about this. And I said, I don't know, but it's supposed to be coming out. They don't know what we're having you on. So they're going to be super excited when we end up posting you out there. And I'm also excited to have you on because of your background. You're very talented. You're dual boarded, correct, with clinical health psychology and behavioral sleep medicine. And I also know there's a huge shortage of you all. And as Donnie mentioned, much appreciated from we call ourselves the clinical sleep health practitioners or AKA sleep navigators. We're very appreciative of all of you because people don't want to admit in the hospital that they may have sleep apnea, many of them that I speak with, but they will tell me in a second that they have insomnia. So you guys have a large population of people. So with all that said, thank you so much and let the audience know who you are and how you got into
And
everything that you're
also,
doing and then save room because we want to know about the exam.
So I want to say this is a conversation.
Yeah.
So just talk and we will have a conversation with you. Know that there is no takes or anything like that. Just a conversation. That's why we do it on Teams because we got full-time jobs and we ain't got time for no production. So just be yourself. Just give it all so the world can see you. Okay? Because we want you to shine. Okay? So shine for us so we can let the world see what you're doing because you're doing some amazing things and we want the world to know. So go ahead, girl.
Yeah, well, thank you both for having me. I'm always super excited to talk about this credential. It's kind of like a little baby of mine, um, that I've been there since sort of the inception of it, and have sort of seen this through and spearheaded a lot of the work that we've done on it. So just to give you guys, well, let me start off by giving you some background about myself. So I am a clinical health psychologist and board behavioral sleep medicine specialist, and I have a private practice in the DFW area called Mind Body Sleep. Um, and I sort of divvy out my clinical work in three buckets. So I do about 35 to 40% sleep work, a lot of mostly insomnia, but not all. And then I work with a functional neurological disorder. So about 30% of my practice is FND. And then I have a general psychotherapy caseload that I like to keep on the side also. So another 30% or 35% goes there. So I like to have varied experiences in my day. It just keeps things kind of fresh and new. I'm also writing a cognitive behavioral therapy for insomnia, or CBT-I workbook that goes along with a program that I developed called Sleep Rehab. So we are in the final stages of that, and hopefully going to publish this year. So that's exciting.
Yes.
Yeah. So there's lots of fun stuff going on in my world, and also like in the world of behavioral sleep medicine that I get to be a part of, which is so fun. Lots of work, but a lot of fun. So we started looking at the Clinical Sleep Health Navigator. So we came up with that term after a lot of debating. We got a lot of feedback from people in the field, from people working as sleep navigators or sleep coaches, and we decided on that term for a lot of different reasons. I know it's kind of been contested or debated when we first started to roll this out, which is perfectly reasonable. You guys have been doing this job for a long time, so it's hard to come in and just sort of rename it or rebrand it. And the reason for that is just elevating the name of the credential to be more recognized in the clinical space, as well as sort of aligning it with the goal of having this national credential, and recognizing the work that we do alongside each other. So, we rely just as much on you guys as you guys might rely on us in referring out for patients. So it's very symbiotic and mutual relationship. And we wanted to kind of recognize that and say, hey, this deserves a national credential. And so that's kind of where that came from. And, hopefully in future space, we get, more insurances on board for reimbursement purposes and things like that. So there was a lot of stuff that went into the naming of this credential. But yeah, so we wanted to provide some structure, some guidance, develop a scope of practice, and really help kind of guide the future of sleep navigators and coaches in all kind of demographics, whether it's pediatric or adult or older adult. And so that was really why we started working on developing the handbook and really outlining what this credential is going to look like. So yeah, any questions about that before I kind of dive into the exam part of it?
We just want, go ahead, Kelly.
Well, this is one thing that stuck out to me. The reimbursement part that you mentioned. So you are trying to get it where perhaps not necessarily the inpatient side, but like on the outpatient side where doctors, I guess, could bill for us, or perhaps futuristically looking, we could have our own practice or something. We could bill.
Exactly.
Oh,
Yeah, that was definitely a consideration, right? We're looking out for everybody here. So, it's tough, especially with the coaches right now who are in private practice, right? It's all cash pay. It helps the patients as well, when they're able to use their health insurance. And so it's a win-win situation. And having the navigator title really does help facilitate that reimbursement level.
Yes, it's because of the oncology, they've already set the standard since they have the oncology reimbursement, oncology navigators.
Yep.
So it's already there.
Yeah. So yeah, it may not be too far off. And once we get this credential off the ground and it's in the field and we're using it and we're seeing the real value of it, is really when that's going to happen.
You have the exam criteria, or because I've been looking on the website and maybe I'm missing it. Is it there yet?
It's not there yet. So let me tell you the reason why it's been kind of a slow process. We began working on the CBT-I credential, CBT-IC, right at the same time we started working on the Clinical Sleep Health Navigator credential. And there was a lot of momentum in the CBT-I community, obviously, because there's really big insomnia work that we do as behavioral sleep medicine providers. And so we pushed a lot of effort into that. We launched that last October. Or yeah, the last fall. We even just started accrediting CBT-I centers that can now train CBT-I providers. So that's really exciting in that arena. So now we're back on the Navigator side and starting to do a lot more work there. So we are just sitting down and developing a work group to start writing the exam. And so we're just starting that process. The exam writing process should take around 6 months or so. And so we're really shooting for a spring of 2027 first quarter launch for that testing cycle for the Navigator role.
Awesome.
Yes.
Yeah. And yet once we get further along in the exam writing process and like can definitively say, yes, we are going to launch, on this test date, that's when we'll start really putting it out there and talking about it, because we want as many of you that have been out there waiting for this to sign up and take it. And yeah, you guys will be the first ones. That's exciting.
Yes. What is the are you allowed to say yet? What is the eligibility or the criteria to be able to take this exam?
Yeah, so in order to become a clinical sleep health navigator or become certified in this, you do have to have certain criteria. A lot of the folks have already been, like you two, been in the field for a really long time. So we have what we're calling a specialty fast track for you guys, which recognizes you've been working in the field for more than 5 years. There's some way that we can attest that, whether it's a supervisor or whatever, signing an attestation of the professional work that you do and how long you've been doing it. You have to obviously have a healthcare license, a coaching background, and then there are various didactic and clinical hours that you have to meet. So that mostly is going to fall under the standard and alternate track of this credential. The specialty fast track would kind of grandfather you in. And the idea there is that we want as many of you guys to get credentialed as quick as possible. So once we launch, that specialty fast track is only going to be available for 3 years. And so get into that 3-year timeline, and then after that you'll have to go through one of the other 2 branches, which is either you'll train in an accredited clinical sleep health navigator setting, which we haven't crossed that bridge yet, but we will once we launch the exam. And so a lot of people will be applying under the alternate track. And the alternate track does have a didactic, clinical consultation requirement.
Okay. Do you have to have, you mentioned so many hours of consulting or discussing insomnia? Would we have to get with one of you all, though I know there's not a lot of you around, depending on what states we live in, to oversee us or anything? How does that work? Or because those people are fast tracked in 3 years, they wouldn't have to necessarily do that?
Yeah, so for the fast track, they wouldn't. Basically, you would, if you're working as a sleep navigator inpatient right now and you have a supervisor, they would basically just attest to the work that you're doing.
Oh, awesome.
Yeah. Mm-hmm.
Well, I got 6 years.
Yeah, most of you do have a lot of years. Otherwise, looking at the eligibility criteria, the sleep training, we want 60 hours of didactic training, 20 hours of coaching background, and that could be in like the health coaching space, and then 50 hours of consultation or supervision, depending on where you're at in your training and career.
Okay. That's exciting. I would think that would motivate. There's a lot of people out there that are doing it. I mention this all the time in a lot of these talks. there's people doing what Donnie and I are doing. We just don't know who they are, and they may not be doing it to the level we're doing it. We have no idea. We're meeting some of them now because you're going to start seeing them come out in the podcast. I'm so excited about it. But there's many others out there that still want to do it. They just don't know how to do it. So I feel like this would be, I don't know. I'm just so excited about it, especially with the potential of the reimbursement. It's like seeing beyond. I know I've been telling this to Donnie and everyone on our team. There's going to be things that's going to happen to us that we haven't even seen yet. It hasn't happened, but it's going to happen. And get on this train, right? Get that CCSH train, and it's going to go beyond your wildest dreams. And then when it happens and you don't have it, you may have a little regret that you didn't hop on that train sooner. So this is so exciting.
Yeah, I mean, the field of behavioral sleep medicine has drastically grown in the last just 5 years that I've been, in board certified and working in the field. So it's I can't imagine, in the next 5 years or 10 years, how many providers we'll have and how many people we will, be recruiting and that'll be interested in working alongside us in this field.
Well, I have a question. Working inpatient, and also we do navigate. So sometimes we're on the outpatient side. Can you tell other professionals, why would someone even call on you guys? What would be the reason why?
Why someone would call on the navigator?
Behavioral sleep.
Oh, behavioral sleep, like, okay,
Mhm.
yeah. In the outpatient setting?
Doesn't matter. We do both. So just
Okay.
just shoot it out.
Yeah. Well, I can tell you because I used to do both too when I was on faculty at UT Southwestern, and
Okay.
I did the inpatient side, and I would do sort of initial sleep consults on the inpatient side. I would put in recommendations to help patients while they were inpatient. You know, just to make recommendations to the team on what this person needed, or maybe refer out to psychiatry for medication management or something like that. So that was really helpful to kind of get people in the door to say, hey, it looks like you're really struggling with this sleep problem that's not just hospital admission related, but that's kind of been chronically going on for a while. And then talk to them and educate them about how important sleep is for health, for physical and mental health functioning, and the implications that sleep loss might have on their health, their acute health issues. And so providing a lot of education on that to the patient, and then bridging the gap to outpatient, where then we could actually really do the work, where whether it was referral to sleep medicine for a sleep study because we suspect there's apnea or something else going on, or if it's CBT-I for insomnia. And so a lot of times it was that initial consult, kind of present the world of BSM to them, because people don't even know that it exists. Patients don't even know to talk about their sleep. And once we open up that door, they're like, oh yeah, I have all these problems, and all this stuff starts coming out, right? So then we can do the real work on the outpatient side.
Okay.
Mhm.
That's about what we do.
Yeah.
Yeah,
And
that's what we do, right? That's what we actually do ourselves at our hospitals. And that you're right, they don't know, because I had one guy, there was a lot going on, and when I mentioned it, he looked at me like, what are you talking about? And I said, I really think this is somewhere you need to go. I think you need some help because you've always done this. And he didn't want to do CPAP, and very adamant about not doing any treatment at all. But he's had poor sleep for so long. And I told him, I said, you're so used to sleeping lousy. Good sleep that you don't even know what that means. So I really recommend. He said, I'll think about it. But we have that option because you guys are available, and we're excited that the things that you do, because everybody can't do CPAP, and even I refer patients that want to do CPAP but are struggling because of trauma or something like that. Go to a behavioral sleep specialist. That's where I need you to go. I understand we're going to get you referred there, so they can have some form of treatment. If CPAP doesn't work out after seeing a behavioral sleep specialist, fine. That's fine. Let's see what else we can do. But let's at least go that route first. Let's not just give up.
Right. No, that's a good point because that is that's a really hard thing as a provider, as you guys know, when um, there are so many options that we have that will help this patient, whether it's working on CPAP acclimation techniques and desensitization or trauma work, right? Things like that, different phobias, or sleep apnea. Whether it's a implant device, right, or something like that, or even surgical procedures that might help them. So there's a lot of options. And patients, when they give up too early, when they're like, nope, 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 that can be really frustrating, because we want to help. That's our main goals. We just want to help.
Yeah, that's why it's not frustrating for me because they have options. And it's not frustrating for me. I have to tell Kelly this when I first started. It's their choice. They have the right to choose. It is their lives. But what I will not do is not do my part. And sometimes that's what I have to do when I go in the rooms. It's like they don't want anything, but I have to tell them, I said, I need to work in excellence. I said, can you let me do my job? Can you just let me tell you what I know that may help you? And you can talk to your wife, talk and think about it, whatever, but allow me to give you what I'm supposed to, and then you can make a decision later. But just don't listen to me just because this is not going to work. That's not, you're so frustrated. Let's have a conversation. If you don't have a conversation, just listen to me. And then let's go from there. So no frustration for me. It's like, you got a choice.
Yeah, I
I
like
got
that.
you though. I
Yeah.
got you, but you got a
I like
choice.
that. Yeah. No, and that's a really good approach and the best way to look at it, right? You do what you can, and yeah, ultimately, we can only do so much.
But the thing is, even if they don't, a lot of times we realize, me and Kelly hear it all the time, they're deflecting to their spouse. Well, she snores louder than I do, and it's like the spouse is in there listening. And that's one thing me and Kelly always talk about, just one. If you get one, you got a community. You got their family. It's a domino effect. You're saving lives and you don't even know who you're touching. But just that's why it's so important for me to tell them to let me work in excellence, because I know that they're going to tell somebody else, even if they don't want to, because you know how we are. I'm going to do it, but you better do it. Don't be doing what I do. You know better. You need to do what you're supposed to do. So they're going to tell somebody. So it's a wonderful thing what we do, just to be able to have the opportunity to let them know about things that, as they tell us, if someone would have told me like that, I would be wearing CPAP, because we meet them where they are.
Yeah.
And that's the amazing part of what we do. Just meet them where they are. We see a human being in front of us.
Yeah, absolutely. And the sad part for me is that I typically see patients when they are at the end of their rope, when they have tried everything else and nothing's worked, and then they come see me, and I'm like, man, you should have seen me like years and years ago, and you should have been referred years and years ago, and but I think it's getting better. I think that is slowly getting better, where we're becoming more frontline rather than fix this thing that nobody else can fix thing. So
And that's what you are for us. You're frontline. You're part of our toolbox for our patients. And the Clinical Sleep Health Navigator, and even what we're doing with the Clinical Sleep Health Practitioner and the sleep navigation, you guys are the part of the toolbox. You're not an afterthought. It's like it's part of it. Okay, we've done
yeah,
this, we've
same.
done that. Yeah,
Mhm.
so yeah, it works out. Teamwork. What they say,
Yeah,
teamwork makes
absolutely.
dream work, something like that.
No pun intended.
So we have about 5 minutes left. And everything Donnie said, I hear at my hospital too. I'm going to be honest, I think within the last 6 years of doing this, it'll be 6 years in June. Out of all these hundreds of patients, maybe 1,000 now, there's a lot. All these
Mhm.
patients, only two of them do I remember ever knowing what CPT-I is. That's how sad it is. And I literally, and our whole team, we have a little sheet that Dr. Patel gave us that he gives to his patients. And has a list of local psychologists that do the insomnia stuff. And there's also a reading list and stuff that they can do. And he says we can give it to patients. So whenever they have any type of insomnia, of course it could be apnea, but there's some instances where apnea doesn't even like, I don't even think this person even has an apnea. You really should go, even if they did, if you don't fix your insomnia, if it's not really, maybe they have apnea and insomnia, but if you don't fix that insomnia, good luck, like you said, Dr. David, wearing that CPAP. Go see the CPT-I person first. So we do hand out little forms of information so they have that with them, and they're much appreciative. But I do want to ask you, I'm going to ask you a little something similar but different to what I ask all the guests
I
at
have
the
one more
end.
thing I want to say, Kelly, to her,
Mhm.
and I wanted her to know how important you guys are. At our at the hospital that I'm at, our congestive heart failure use behavioral health for their patients. That's how important you are where we're located. So you guys are really making a difference. So I just wanted to let you know that it's just not sleep and pulmonary. We got even heart failure. And they did a whole slide presentation at one of the meetings to let us know that they were there for our patients. So just wanted to give you guys kudos. We really appreciate you guys.
Yeah, we're like infiltrating the space.
That's right. Go ahead, Kelly. I'm sorry.
No, that's okay. So with this vision of this new clinical sleep health navigator, what vision are you guys seeing that formed this idea? Because I'm thinking, listening to you, and 2 years ago as well, is this going to be something similar to like the advanced practitioner for respiratory therapy, where they created that role for them and they had to take the exam? Um, and they are almost like APPs in a way in the hospital, but of course they're being overseen by a physician. Is that where you see it going further in the future as well?
Yeah. Um, yeah, I mean, that definitely aligns or sort of paves the way for the vision for this credential as well. Sleep, as we've been saying, this whole time, is not as widely talked about or recognized. Whether that's on the respiratory side, even the cardiac side, right, with the apnea piece, or insomnia side on the behavioral piece. But for this credential, yes, we definitely want to build something that is going to be recognized over time, and being so valuable that we have CSHNs in every department, right? In cardiology, in pulmonology, in, I don't know, infectious disease, I don't know, you name it. And we need clinical sleep health navigators there, because we need to be talking about sleep and training sleep in all fields of medicine. That's my opinion. But yes, the vision is that we want to see this credential take off, and be really integrated and accepted. And I think it will. I mean, if you are applying for a job at a hospital and they see that you have this national credential, I mean, that's going to look really good. Just as your really levels up your expertise and solidifies that.
Well, anything
You
you want to leave the world with? Because this is your platform.
Oh, so many things. I just want to say thank you to both of you. I'm always excited to talk about behavioral sleep medicine, and also these credentials that we've been working so hard on in launching. It's been uh, like I said, it's been a lot of work, a lot of effort, a lot of thought and consideration and consultation. And so we want this credential to bring us closer together, right? The community of sleep medicine and behavioral sleep medicine and navigating. We want us to be a well-formed, team that we have, that we can all work together with. And that's really the idea, is to get more people out there that are talking our language.
Awesome. You're right. Talking our language. Exactly. That's what we need. People talking our language. Sleep, not anything else.
Exactly. Yeah.
And have the credentials to back it up. That's all I'm saying. We got to own
Yes.
this.
All
And
right. Well, I
I'm
better,
excited.
Donnie and Kelly, I better see your names on the list when we when we put that launch date out for this exam.
We will.
I'm
We'll be there.
excited.
Yeah, we'll be there. Kelly's so excited she can't even hold her pee. She's so excited.
We should set up a, little virtual happy hour afterwards or something to just, represent the launch of this and celebrate that.
That would be awesome. Yeah.
That would be
But
awesome.
you guys
But you
deserve.
know what? We actually need to get together in person, and nothing like that connection. So maybe a year after that, all that happens, everybody should get together. Because it's this Zoom and all this, we're losing that touch. We're losing that connection.
Well, we hope to have you guys at our annual conferences, our Society of Behavioral Sleep Medicine conferences, which usually are in the fall of every year. So if we launch in the spring, we want all y'all to come to our conference in the fall so we can have that connection and learn who you guys are. You guys are
That's
important.
awesome.
Yeah.
Yes, it
That'd be
is.
awesome.
Oh, I'm sorry, I did interrupt you. What were you going to say, Dr. David?
Oh no, I was done.
Okay. Well, thank you so much for honoring us with your time. It has been a pleasure. As you can tell, Kelly is super excited.
Yes,
She
I
can't
am.
wait.
This
She can't
podcast
wait.
is amazing because sleep is magic. Yay, I love that title.
That's
Thank you
Donnie.
so much.
That's all
Yeah,
Donnie.
yeah. That's
Yeah,
awesome.
Kelly's a leader. We did a little character test to see our strengths, and of course Kelly came high on leadership, and I came high on creativity. And I've always told her that. I said we balance each other, girl. That's why
Love
being in
that.
business with you works out. It works out.
I love that. You guys are a
And
good
she is.
team.
Yes, we are. Like she always tells everybody, I don't like LinkedIn. I don't like to be on social media, but Donnie pushed me. I didn't want to write the book. I didn't write the book, but Donnie pushed me. And that's because I care about her and I think that she deserves all the accolades that she is getting with her new fellowship, being a fellow at AST. AST. And because of all that she's done. So I am honored for her to be my partner, my friend.
Awesome.
Yeah, yeah. So
Yeah.
thank you
It's
so
been an
much.
honor to work with you, Kelly, in over these last couple of years as we've, you know, you've been such a valuable member and asset in helping us build that vision that I was talking about. And it's a pleasure to meet you too, Donnie. I'm sure you are doing just as big things in the field too.
She is. She is. Big, big, big
Anyway,
things.
well, thank you so much again. We thank you so much. I'm gonna go ahead and end this.
Yes, thank you.
Okay, let's end it. Stop recording.